My goals here are to give you an introduction to what we do, to make you better consumers of the kind of microsimulation work that we do, so you understand what goes into a microsimulation model and what you might do with it, and then show you a few applications of what we've done with it over the years. We have two models here at the Schaeffer Center. There's the Future Elderly model, which is based on the Health and Retirement Study. And then we have another simulation called the Future Americans model, which is based on the Panel Survey of Income Dynamics. The microsimulation allows us to look at disease burden, health disparities, healthcare costs, and then also we look at a lot of implications for government programs, looking at Social Security and Medicare and Medicaid. If you think about the way the survey works, let's say someone responded to the survey in 2010 and 2012. We're modeling what happens to them in 2012 based on what we saw in 2010. The kinds of things we're modeling on the health side are, do people die? Do they have incident cancer, incident diabetes, incident heart disease, etc.? And all of those things will be predicted by the observations from 2010. We use some other nationally representative health studies. So we have the National Health Interview Survey and the National Health and Nutrition Examination Survey. And where we're going to rely on those is for understanding trends for our future cohorts. So the future cohorts, that'll come up in just a minute, but these are going to be our synthetic populations that are going to come in as the simulation continues to run. And basically, I need to have some best guess as to what their BMI might look like, what their smoking status might look like, what diseases they might have developed by age 50. So we're going to rely on those data sources for trends in those. This is where we're going to apply all these transition models. And so for anyone who in 2014 did not have diabetes, I'm going to predict, do they develop diabetes for 2016? And so the way that's done is we're going to apply that transition model that I showed earlier, come up with a predicted probability of that, do a random draw against a uniform distribution, and then assign yes or no, this person has now developed diabetes. Now we're in 2020, this is the future, right? So often when I present this, people ask about these 2016 and 2018 cohorts, why are they synthetic? And the reason they're synthetic is because the 2020 cohort has to be synthetic. And so we're using the same framework to assign the characteristic of all of these cohorts. And so we're actually going to generate replenishing cohorts through 2030 or 2040, depending on how far out we want to forecast. And all of that is going to rely on a lot of assumptions about trends continuing. But we also do a lot of things where we start changing things that are happening in the simulation. And so the first type of thing that we might do is changing the initial characteristics of the population. And so that actually might be something even in a cohort simulation where I might start with my 51 and 52-year-olds and they have a certain BMI distribution. And someone might say, well, yeah, but what if we had a different BMI distribution? How would their lives look different? And so we would adjust their BMI distribution in a particular way, and then compare the counterfactual world to the current world. I wouldn't turn my nose up at saving 7% of Medicare's burden, but the reality is that would not make Medicare solvent for more than a few more years. The health stuff alone is not going to be enough to, in our modeling, would not be enough to make these programs solvent. But from an individual perspective, it's fantastic because people live longer, healthier lives. The things that really drive mortality in FEM are age, not surprising, chronic conditions, but the ones that really are strong predictors are the functional limitations. So the ADLs and the IADLs, they really do indicate poor health. And so it's important to get those right. We have a really rich set of projects that we do here at the Schaeffer Center. We love external collaboration. If you have a project idea, I'm happy to talk about it with you.